Hi, I'm Dr. Shashikant, orthopedic surgeon specialized in joint replacement and sports injuries. Let's talk about osteoarthritis today. If your mother has arthritis, there is a high risk you may get arthritis. But that is not the only deciding factor. Let us look into other factors which play a role. We can divide those factors into factors which we can modify, factors which we can't modify. So let's look into factors which we can't modify. One of the important factors is age. Elderly people are more prone to arthritis than the younger ones. Females again are at higher risk than the males. So we can't do anything about the age and gender. Let's look into the interesting part, modifiable risk factors, something we can do about. Most important is obese or overweight people are at high risk. So when we look at the weight reduction programs and structured lifestyle modifications, definitely we can reduce the risk of arthritis. Next important factor is occupational risk. People who do prolonged standing, who do sitting cross-legged a lot, or people whose job requires frequent stairs, they are at high risk. So when we can change the occupation or we can give them some programs to help reduce the risk of arthritis, that helps a lot. Next important factor is muscle imbalance or the muscle weakness can also increase the risk. So structured physiotherapy programs or exercise programs can also reduce the risk of arthritis. Next important factor is metabolic syndrome. People with high blood sugars and high blood pressure are also at higher risk. So controlling the blood sugar, controlling the blood pressure can also reduce the risk. In the next video, we'll look into symptoms of arthritis and how to diagnose at early stage. Thank you.